Hello, I'm Brett Sutton, Victoria's Chief Health Officer. As you know, we've seen a significant increase in cases globally, in Australia and in Victoria, of coronavirus or COVID-19. That's a concern for all of us, and I understand that it causes significant anxiety to see what's playing out across the world. What we know is that there are things that we can do now to protect ourselves, to protect our families, our friends and our loved ones. And so we know that proactive measures that we can take now can make a difference to what happens with the increase in cases. What we're trying to do is to flatten the curve. That means that we want to slow the increase in numbers of cases so that we don't get an overwhelmed health system because we've got a huge spike in confirmed cases of illness that all need care in hospital. What we are doing from Monday the 16th of March is to put a ban on gatherings of 500 or more people. These events or gatherings can no longer go ahead if they're static groupings of people that number 500 or more. I know people are concerned and anxious about the global situation and what's happening here. In Victoria, we are taking a proactive approach. These measures are very disruptive, I understand that. But we're doing them now, and we're doing them with relatively few cases in Victoria in order to get ahead of the game. What we know is that if we can do social distancing now, reduce the chance of transmission of coronavirus between people, then we'll flatten the curve and we'll have a lower peak in this pandemic. And that means our health services will be spared from the extreme levels that can happen in an epidemic. We have to be proactive in order to make sure that our routine services and our way of life is as normal as it possibly can be. But these disruptions are going to be really significant, and they'll apply to broad areas of our lives. That said, there are things that we can do from now that will help protect us. That includes washing our hands regularly for 20 seconds, coughing into your elbow, and if you're unwell, really important to stay home, to stay away from work, to stay away from public places, and especially to stay away from vulnerable people such as the elderly or those with chronic conditions. Most people do get mild disease, but for those vulnerable individuals, disease can be really severe. So it's absolutely imperative that we're doing all of those things to protect those who are most at risk. A lot of people are concerned and want to get tested. That's understandable. What we know is that we really need to focus our testing on those people who are most at risk of getting the illness. That means, for the moment, returned travellers, our healthcare workers, and close contacts of confirmed cases. For everyone else, I know there's concern, but we don't have, at the moment, the testing capacity to test the many thousands of people who might have symptoms of upper respiratory tract infection, coughs and colds, but who don't fit into those risk categories. As soon as we've got that capability and capacity, we'll expand our testing to make sure we can capture as many people as possible. As I say, we're doing everything that we can. We want information to get out there so that people know what to do for themselves. We do have guidance on quarantining yourself at home if you need to be isolated because you're a contact of a case, and isolation if you're unwell. So go to the DHHS coronavirus website. It's got loads of information, and read it, understand it, and put it into place. Thanks for your cooperation.